Hi, friends. This is a cancer screening form that I did not expect to be looking at today. It was included in this packet. And basically, my friend sent me over some medical records to review. So this is a list of different kinds of blood tests, imaging tests like CT, MRIs, PET scans, ultrasounds, and then some other specialty tissue tests that my friend asked if I could review. And the reason why I'm looking at all of this is because her brother was recently diagnosed with stomach cancer, and his wife wants to know if their kids should be screened.
What is really alarming oncologists is this sharp rise in cancer incidence among young people.
There is a very strange and disturbing thing happening with cancer.
Those in their 30s and 40s are experiencing unprecedented and world-leading rates of cancer.
So in this video, we're going to go over quite a few of these common cancer tests and talk about what you can actually get from them, what they actually reduce your risk of, and which ones are really important for you to get. And by the end, you'll understand that the power of reducing your risk of getting cancer is actually not on this sheet. It's in your hands. Because one of the most dangerous things about these cancer screening tests that people offer you is that they can give you a false sense of peace. You know, if your test is normal, that's great, but that doesn't mean that you're not at risk. Now, it really made me realize that when you personally know somebody with cancer, then it totally changes. Cancer is no longer a statistic. And you start thinking, well, what about me and my children? What are our risks and ways in which you can reduce your risks? The short answer is, yeah, we are all at risk of cancer. But by the time most of these tests are positive, it may be too late. Basically, you already have cancer. You may even have an advanced stage of cancer like my friend's brother, who has stage 4 stomach cancer. He was diagnosed 3 weeks ago. My name is Dr. Liu, and I'm a double board certified physician. I've been in practice for almost 3 decades. And I have had the privilege of meeting and supporting thousands of cancer patients, even though I'm not an oncologist. And that's because if you have cancer, you are at high risk of getting an infectious disease. So I get to meet a lot of different people. Many infections, in case you didn't know, are also direct drivers of cancer. And the purpose of this video is not to scare you, but to empower you to know that you can reduce your risk of cancer even today. And if you have cancer, you can increase your chances of surviving cancer, possibly, if you watch this video to its entirety. Unfortunately, most of these screening tests that we can offer, it doesn't actually reduce your risk of getting cancer. What they can do is reduce your risk of dying from cancer if we can find it early enough. And if there's a treatment for you that works. Let's start with colon cancer.
At that time, I was having so many issues, and I feel like I was just getting kind of brushed off.
I never thought that I would have cancer because I was like just young, 26 years old, you know.
James Vanderbeek, who passed away on Wednesday at just 48 years old.
It's been in the news quite a lot because lots of young people are getting it. And if you are 45 or older living in the United States, you should get at least one time some kind of colon cancer screening. And if you're older than that, hopefully you've gotten more. The point is that colon cancer screening is one of those screening programs that actually can not only reduce your risk of dying from colon cancer, but it can reduce your risk of getting colon cancer. For example, colonoscopy, it is the gold standard procedure, and you'll understand why a little bit later. I guess to describe it, they put a long camera up your colon.
That's it. Colonoscopy.
There it
So
is.
Your colon, there was actually a polyp there.
The purpose is to find precancerous lesions and then snip them out.
So a polyp is a precancerous lesion.
And if they can find something abnormal and remove it, then that's it. You reduce your risk of cancer. That is only if you can get a colonoscopy. And if you can do that with a good gastroenterologist, you reduce your risk of getting colon cancer by 50%. I mean, that's worth buying a lottery ticket. And if you have colorectal cancer, you can reduce your risk by up to 60% from dying from that cancer if you get a colonoscopy. The alternative, let's say, you don't have a colonoscopy available and you really want to know now, that would be just to check your stool. And the first test that we're going to talk about is called the FIT test, FIT, which stands for a fecal immunochemical test that looks for blood in your stool. Now, this test should be done at least once a year, and you'll get some cards and a little scooper that you can put on and then mail that in. And if it's positive, you basically need a colonoscopy. The second test is called a FIT DNA test. And currently there's only one FDA approved FIT DNA test, and that's called Cologuard. Now, what's special about this test is that not only look for blood in the stool, but it also looks for DNA, abnormal DNA that's shed by your colon from these cancers. Also abnormal DNA from precancerous polyps, ones that have not quite yet turned into cancer. And that is actually a better test than the FIT test alone. So if you can get the FIT DNA, that's so much better. But the problem is there are false positives that can increase with advancing age. And the other problem is if you get a negative FIT DNA test, then you should get that repeated in 3 more years. But if it's abnormal at all, you need a colonoscopy. Now, if a colonoscopy and the FIT tests are not available, then your physician may recommend you to get a flexible sigmoidoscopy. So what's the difference? Well, they still put a camera up your rectum to look at spots, but it really only looks at the left side of your colon as opposed to your entire colon. And some physicians actually combine the flexible sigmoidoscopy with the annual FIT test. And if that isn't available, some people actually choose to get a CT scan, a computerized tomography colonography, or CTC. That does require radiation. It does require you to drink like this prep drink where then they can look at your guts, basically your colon. At the same time, a small tube is inserted into your rectum to inflate your colon. And if that's abnormal, you will also need a colonoscopy. We also have tiny cameras that you can swallow to look at the abnormality. Basically, a trained gastroenterologist will need to review those images. Of course, if the camera doesn't turn and misses a spot, then it's missed a spot, right? But if it captures anything abnormal, you need a colonoscopy. Sometimes people may offer you blood tests, which may be good at detecting cancer, but it does not detect precancerous polyps before cancer happens, right? The whole point is, can we catch something abnormal and change that so it doesn't turn cancerous? And the only cell-free DNA test available is called SHIELD. Again, if this test is abnormal, you would again need a colonoscopy. Now, do you see the theme here and why the colonoscopy is a gold standard? It's because no matter how invasive or non-invasive your test is, whether they inflate you or not inflate you, ultimately, if you have something abnormal, people need to go in and snip it out, right? And that's the power of a colonoscopy that many of these tests can't reach or can't provide. I've had a colonoscopy. It's really quick. I mean, literally, you go in, they talk to you, you fall asleep, and you're done. Of course, you have to prep yourself. That's actually, I would say, more challenging than the colonoscopy itself. Now, another powerful screening test is a cervical cancer screening test through pap smears and HPV testing. And this is super powerful because we're finding abnormal cells or precancerous cells before people develop cancer. That's the whole point of an excellent cancer screening tests. Now, serial cervical cancer programs have dramatically reduced both cervical cancer rates as well as deaths from cervical cancer. And in some analysis, it's estimated that these pap smears, these cervical screening, they've actually prevented, let's say, around 70% of people with cervical cancer to die. And the recommendations, they have changed over the years. So the American College of Gynecology for 2026 recommends different screening intervals for different ages of people. So if you're younger and you're not super high risk, then it's every 3 years. If you're between the ages of 30 to 65, and it depends on your risk. So if you have a high risk of getting HPV, then it may be testing HPV alone for every 5 years. You know, they can actually give you collection specimens to test HPV for every 3 years. And alternative, you can actually test HPV as well as cytology every 5 years if you combine it. And if you just do the cytology, that means a PAP alone, that's recommended every 3 years. Now, if you're over 65, then they don't actually recommend people need screening if they've had several years of negative screening. In case you didn't know, PAPs are not just for women. Have you ever heard of an anal PAP? This is a PAP test most people probably haven't heard of because it's not for the cervix, but it's for the anal canal. It is called an anal PAP. And it's not a colon cancer test, very different. This test is actually looking for HPV-related precancerous changes that can lead to anal cancer. And in the general population, anal cancer can be rare, like 2 cases for every 100,000 people. But in certain high-risk groups, especially people who are immunocompromised, either living with HIV or having cancers in their private parts or immunosuppressed. So this is not necessarily screening for everyone, but it may matter a lot for the right person. The most important study is called Anchor. That showed that high-grade anal precancer, that actually reduced anal cancer by 57%. And again, not everybody needs a rectal pap. So notice how screening changes when you have HPV. I've said that word many times, and you probably don't know what it is. It's called human papillomavirus. It's one of the most common viruses found in the world. It can cause cervical cancer, anal cancer, throat cancer, and it's really a test of immune surveillance. You know, most people are exposed, most people clear it, but when high-risk HPV infection persists, especially when you get serotypes 16 and 18, it can slowly reprogram normal cells over those years to become precancerous cells and then cancerous cells. And that's why a normal test done today does not mean you can ignore prevention for tomorrow, right? The goal is to not just find cancer early, but to prevent cancer. And that means the virus, we got to prevent the virus from actually getting the virus and then stopping the virus if you already have the virus, right? And unfortunately, these days, you know, cancer isn't rare. There's so many different causes. In the United States, American Cancer Society projects there's going to be 2.1 million new cancer cases and about 620,000 cancer deaths this year alone. That means cancer, it's not just going to be in the hospitals. It's a disease where you're going to be exposed, families, workplaces, churches, basically ordinary people that thought they were doing fine is going to be touched by cancer. And here's where it gets complicated. We often talk about cancer as if the solution is simple. Find it early. And yes, when cancer is found early, treatment can be more effective. But again, not every test finds cancer early, and not every abnormal test means you have cancer. And not every normal test means that you're safe. And that's why it's important to seek advice from a trained medical physician before you randomly order any cancer tests. The National Cancer Institute explains that screening means looking for cancer for basically before symptoms appear. But screening tests can create false positive results, false negatives. They can overdiagnose, overtreat, and then cause anxiety, sometimes even complications following these procedures. Have you heard about liquid biopsies? The idea is amazing. You have cancer cells that shed DNA fragments like proteins and other signals into the blood. So instead of waiting for the tumor to grow large enough to see on imaging, the idea is that we can detect the cancer in the blood from a blood draw or a body fluid sample, let's say from your peritoneal cavity or your pleural fluid. Unfortunately, not all cancer cells shed They don't shed parts into the blood. And that's why these tests, they have their limits. This is really a test for personalization or precision medicine. It can be very useful to determine how well treatment is working or how well, the mission is going, right? You may also have heard of multi-cancer detection tests, or MCED. And this is a new type of lab test that looks for signs of many types of cancer in one sample. Unfortunately, these tests are not yet FDA approved, and they're not currently a replacement for the recommended screenings. The idea is you can pick some kind of body fluid, your blood, your saliva, your urine, and check for cancer. And they look for pieces of DNA or RNA and protein from abnormal cells. Again, it's to find cancer early. But these tests, they don't diagnose cancer. And most types of cancers, honestly, don't have a proven screening test. In fact, nearly half of the cancers diagnosed each year have no recommended screening tests. And that's why they're often found in later stages. They're often very hard to treat. And these tests are in its early infancy when it comes to healthcare. So far, more than half the people with a positive multi-cancer detection test, their results are then later double-checked in follow-ups, and they don't have cancer. And that's a big deal. Imagine you get a test, it says you have cancer, and then it turns out to be a false positive. Maybe you've gotten now CT scans, PET scans, that's radiation after radiations, or endoscopies and biopsies. And what if all those are negative? Are you going to feel relaxed or be in fear for the next year that maybe you still have something? On the other side, what if the test is negative? And does that mean you have no cancer? No. These tests can miss cancer, especially early stage cancer that shed little DNA into the blood. So I'm not against these tests. I'm really excited about the science, but I would use them not as standalone reassurance. Liquid biopsies also may become powerful complement to existing testing. But today, it should not replace things like mammograms, colon cancer screening, cervical cancer screening, lung cancer screening for high-risk people, or sitting down and looking at symptoms. So don't trust any blood test alone just because it sounds advanced. Now, let's talk about some of these blood tests that people often ask for. These tumor markers like CEA, CA125, CA19, 9, AFP. And sometimes people may order these as a cancer panel because they're cancer markers. Why not check them as a screening? Well, the problem is most tumor markers are not good screening tests for the average risk person without symptoms, without lesions. The National Cancer Institute says common tumor marker tests are mainly used to help determine if treatment is going well, or to help with diagnosis, or to determine treatment, basically to monitor cancer. It's not as a broad screening test for the general public who are at low risk. So let's take CA125. Many people know it's elevated in ovarian cancer, but did you know that it can also be elevated in endometriosis, fibroids, menstruation, pelvic inflammatory disease, liver disease, and other non-cancerous conditions? So if it's high, it doesn't mean you have cancer. If it's normal, it doesn't mean you don't have cancer. CA19-9 is associated with pancreatic cancer, but it can also rise if you have pancreatitis, bile duct obstruction, cholangitis, liver disease, and other gastrointestinal cancers. Some people do not even produce CA19-9, even though they have pancreatic cancer. So again, it is not a clean screening test. CA can rise in colon cancer, but it's also found in smokers, inflammation, liver disease, as well as other cancers. AFP is associated with liver cancer or germ cell tumor, but it is not a general test, do I have cancer? And this is where these cancer tests are easy to get, but they can be a trap, right? A number is maybe slightly high. Now you're terrified, but all these other numbers, if they're normal, are you cancer-free or not, right? Both reactions can actually be misleading. So tumor markers, they can be extremely useful in the right context. If somebody already has a known cancer, a marker may help monitor treatment response or recurrence. But sending tumor markers for fishing expeditions can honestly cause confusion, false alarms, and false reassurance. So don't trust tumor markers alone. Really go and talk to your medical doctor to determine if you really need that. And by the way, If you find values in my videos, would you mind checking if you're subscribed? And if you are not subscribed, please hit the subscribe button, like button, and share button, because it does change how many people get to watch my videos. I appreciate your partnership in helping to change the world. Better screening tests that most people are recommending is mammograms. There are 3D and 2D mammograms. It seems like 3D mammograms may be a little better, but the jury is still out. You do get a low dose radiation whenever you get a mammogram, and you get about the same for both. So my friend recently had an abnormal mammogram, and therefore she had to get a biopsy. Now the mammogram is basically a low dose x-ray for your breasts. And in the average, you're exposed to 3 millisieverts of radiation in your background from just existing, right? The radiation dose of a screening mammogram for both breasts, they're equivalent to the amount of radiation that you would get in about 7 weeks of your natural surroundings. So that's not insignificant. And that's why if there's any chance you can be pregnant, you really need to let them know. You know, when you get a mammogram, it's not comfortable. The breast is compressed between 2 plates. They're looking for calcification, distortions, any kind of suspicious changes. And it can detect breast cancer before people feel a lump. However, when you have dense breasts, they're most likely to get a false negative result. And that means that it's really not good at detecting cancer in women with dense breasts. There can also be false positive results in women who are younger and who have dense breasts, or in women who's taking estrogen, or even have a higher risk for breast cancer because it runs in the family. So my friend, she actually got a false positive from a mammogram because afterwards they biopsied it and it was negative. Now, the United States Prevention Task Force recommends that a screening mammogram to happen every other year for women ages 40 to 74. But it also acknowledges potential harms, including false positive results, more testing, follow-up procedures, overdiagnosed, overtreatment, and radiation exposure. And this is where nuance matters. A false positive can mean someone is called back for more imaging or biopsy to really find out if there is a problem. And yeah, that can be terrifying. People can get false negatives. That can happen when cancer is present, but then it doesn't catch it because of dense breast tissue. So overdiagnosis, means that the test finds a cancer that may never have harmed the person during their lifetime. But once you find it, it's really hard not to do something about it. And that's why it's important to get with your own personal medical doctor to discuss whether or not you should be getting a mammogram. And remember, both women and men get breast cancer. But there is one test that is only unique to men, and that's PSA, prostate specific antigen. It is a protein made by the prostate tissue, and it can be detected in the blood. Higher PSA can be associated with prostate cancer, but it can also be from benign prostate states like enlargement, prostatitis, recent ejaculation, urinary retention, even biking and instrumentation, or simply people growing older. So this test is controversial because even though prostate cancer is common, not all prostate cancers behave the same way. Some are really aggressive and life-threatening, especially in certain populations like those from West African heritage. Others grow slowly that may never cause any harm. And it's really interesting. When I went to medical school, I was taught all men will get prostate cancer if they grow old enough. And now I realize that that's not true. That may be true here in the United States, but it's not true around the world. So that means something in the environment is encouraging prostate cancer if you move here to the United States. However, it still is the second most common cancer around the world behind lung cancer for men. And the United States Prevention Task Force, it really says that men ages 55 to 69, whether or not they should screen should be on an individual basis, right? Because there are a lot of harms noted, false positive, psychological harms, biopsy, complications, overdiagnosis, overtreatment. And if they have followed people for over 10 years and more than 15% of the men were screened every 2 to 4 years, had at least one false positive result, and about 1% of prostate biopsies resulted in complications requiring hospitalization. And that's kind of the PSA dilemma. If you never screen, you miss aggressive cancer early. If you screen everyone aggressively, you may diagnose and treat more than just cancer. Maybe they didn't need treatment, and then you're causing them complications that include urinary, sexual, and bowel. So PSA is not just a simple, let's check it as a conversation, right? It's really what's your baseline? How fast is it rising? what's your prostate size? Do you have a family history? Like I said, people of West African ancestry are more likely to have a genetic variant that leads to prostate cancer. And if you're at high risk, other imaging modalities and biopsies may also be necessary. Just don't rely on a PSA alone. I had mentioned CA-125 for ovarian cancer. Another way to screen ovarian cancer is ultrasound. And ovarian cancer is scary because it's really diagnosed late. And some people, understandably, they're asking, why can't we just send a CA-125 blood test or do a pelvic ultrasound in everybody? Well, unfortunately, the answer is quite painful because it hasn't worked well for the average person, for the average asymptomatic woman. So the U.S. Preventive Task Force recommend against routine screening for ovarian cancer in people who are not symptomatic. But if you have a high-risk hereditary syndrome, then screening is important. It may include some false positives that may lead to unnecessary surgery in women who don't have cancer. And that is one of the hardest things to explain because it feels really counterintuitive. How can more testing be harmful? And it's because ovarian cancer is relatively uncommon. And compared to let's say benign ovarian cysts, fibroids, hormonal changes, and other pelvic findings. So that means if you screen a large number of people who are average risk women, there'll be many abnormal results that aren't cancer. And these abnormal results can lead to repeat imaging, anxiety, surgery, and complications. So that doesn't mean you just ignore ovarian symptoms, right? So if you have bloating, pelvic pain, early fullness, urinary urgency, unexplained weight changes, or persistent abdominal symptoms, you really should be evaluated. And if you're at a high risk, especially if you have the BRCA mutation, a strong family history, you really need individualized care. See your own medical doctor. Now let's talk about the number one cancer in the world, lung cancer. And for decades, people thought, why not just get a yearly chest x-ray? It's cheap, it's quick, it's available. The problem is that chest x-rays are not good enough to screen for lung cancer. The National Cancer Institute states that based on solid evidence, screening with a chest x-ray or sputum cytology, that actually doesn't help. It doesn't reduce lung cancer mortality in the general population or even in people who are at high risk like smokers. It's important because lung cancer can hide. A chest x-ray can miss small tumors, tumors behind the heart, tumors in difficult locations, or early lesions. So how else can you do it? Well, you can send a low-dose CT. The U.S. Preventive Task Force actually recommends an annual low-dose CAT scan for adults 50 to 80 who are at least a 20-pack year smoking history, who are currently smoking or have smoked within the last 15 years. But even low-dose CT can have harms, false positive, incidental findings, radiation exposure, anxiety, as well as follow-up procedures. So again, the point is not to never test. The point is use the right test for the right person. What about scanning your entire body, a whole body MRI and full body scans with a promise to look everywhere? Well, if you can afford it, it's more benign than radiation, than CT scans. But when you scan everything, you find things. Liver cysts, kidney cysts, thyroid nodules, lung nodules, adrenal nodules, spinal changes, a lot of old injuries. And these things may never have changed your quality of life or affected your lifespan. But you'll have more radiation if you do a CT, biopsies that may lead to more complications, anxieties. So a whole body MRI can have, a role in high-risk genetic syndromes, such as Lee-Fraumeni syndrome, but it needs to be done under expert guidance. But for the average person, it's not the same as evidence-based cancer screening. And the danger is really two-sided. A normal whole body CAT scan can miss microscopic cancer, early mucosal cancers, or blood cancers, or tiny, tiny lesions. And an abnormal scan can send you down a rabbit hole that really never needed to exist. Now I'll talk about genetic testing, which is, I think, what my friend had in mind to do for her children. Genetic tests can be incredibly important. BRCA1, BRCA2, Lynch syndrome, APC, TP53, and others, they can identify inherited cancer risk. If you are truly carrying a high-risk mutation, that can change your screening, prevention, and family planning. But genetic tests does not tell you whether you currently have cancer. It tells you if you inherited the risk for it. And even that interpretation matters because some results are pathogenic and some are benign. Some variants have uncertain significance, which means we don't really know what they mean yet. And a negative genetic test doesn't mean that you cannot get cancer, right? Most cancers are not caused by inheritable mutations. They develop from a lifetime of interaction of age, immune function, hormones, metabolism, inflammation, infections, toxins, and random DNA damage. So what are you going to do with the knowledge that you carry those genes if it's positive? You're going to have more anxiety? You're going to get more procedures? It's a real dilemma, isn't it? And that comes to the real problem with my sheet of tests. Testing is not prevention. And here's a mistake our culture keeps making. We treat cancer like it's a burglar. We think about, can we catch it when it breaks in the house? But wouldn't it be better not to have the burglar break in? Wouldn't it be better not to have cancer, right? So cancer, you should think of more like a neighborhood changing slowly. The immune system is changing. Hormones change, like insulin goes up, inflammation changes, and then your microbiome changes, your DNA repair, it gets changed, and your mitochondria change. So the whole environment of your body where the cancer lives changes. And this may allow cancer to grow or not. So yes, screening is important, but screening is for surveillance. Most of the time, it's not good for prevention. It's kind of like a smoke detector. If it goes off, then it's great, but it doesn't fireproof your house. And cancer is that important. A cancer test doesn't automatically lower the condition that helped cancer grow. And after my friend's husband was diagnosed, I said to my friend, your kids are really too young for these screening tests. But more importantly, what can you do every day to support their bodies to be less welcoming to cancer? And that's why the most important part of this video is right now. The most important thing you can do to reduce your risk of cancer is to build your diet around whole plant foods. Stuff like vegetables, fruits, beans, lentils, whole grains, nuts, and seeds. So many institutions, they recommend that people should be eating more plant-based foods, whole grains, whole beans, lentils. They all play a major role in cancer prevention because these foods, they provide fiber, nutrients, and phytochemicals. Have you ever thought, why these foods are so important? I mean, really, why are they so important? It's because they interact with your immune system. Cancer therapy is more successful these days because the therapy is training your immune system to take your own cancer out. That's called immunotherapy. So every time you eat plants, all of these plants, you're giving yourself immune therapy. It's just in food form. And of all the plants that are most important to add, some of these are it, folks. Beans and lentils, not only high in protein, but fiber, resistant starch, polyphenols, minerals, and it fuels your microbiome. Your gut microbiome ferments short-chain fatty acids like butyrate that helps you maintain your colon barrier to support healthier immune signaling to reduce your rate of many cancers, especially colon cancer. And there are published papers to say kids who eat soybeans, they actually get less cancer as adults. It's not just true for beans and lentils, it's also true for mushrooms. Women who eat mushrooms have a low rate of breast cancer. Mushroom contains an aromatase inhibitor that may be crucial to reduce the effect of estrogen, thus preventing hormone receptor positive breast cancer. There are many mushrooms, turkey tail. It has in it PSK, and it's been used in Asia alongside chemotherapy to boost their immune system to improve survival rates. Reishi, it also is known to inhibit the proliferation and invasion of inflammatory breast cancer cells, and it may reduce cancer-related fatigue during treatment. Maitake, there's studies on it that suggest that it may enhance immune response and stimulate natural killer cell activity in breast cancer survivors. And my favorite, shiitake, that contains a molecule called lentinin, which may improve the quality of life as well as treatment efficacy when used alongside certain cancer regimens. But again, don't do any of these on your own. Really, you should speak to your medical provider if you're going to go on any of these foods that in concentrated forms, right? Like mushroom supplements or even eating them. And if you think about it, mushrooms have been used by humanity for thousands of years in Asia. You know, we're big mushroom eaters, and the advent of social media have really highlighted the power of these foods and the benefit of mushrooms. But remember, there's no over-the-counter mushroom supplement that's going to be able to guarantee good results. And none of them are FDA approved. I think the only FDA approved mushroom compound is called penicillin, and that has revolutionized the practice of medicine and saved probably billions of lives at this point. So it's not far-fetched to think that we're going to find other compounds in mushrooms that can change human health. And if you're into mushrooms, you really need to be careful because many of them have dual effects. But other things you can do are to reduce processed meats and minimize red meat. This includes eliminating deli meat as well as steak. The fifth thing to do is to stop drinking pure sugar. Liquid sugar, it hits the liver quickly, raises your insulin, and insulin promotes fatty liver in susceptible people, and it also doesn't create the same fullness as intact food. So sugar-sweetened drinks are part of the problem along with ultra-processed, like solid food, because every time you increase insulin, you increase cancer growth. Now, the sixth thing you can do is really to limit your ultra-processed foods, high in refined flour, sugar, processed oil, salt, emulsifiers, chemicals, really low fiber starches. They increase your insulin easily because they're usually eaten with a lot of fat, and that increases cancer growth. I keep mentioning insulin, so that means the seventh thing to do is get insulin sensitive, not resistant, right? That means eating more beans, grains, fruit, low fat, high fiber foods, limit the refined starches and refined fats. This is because when you drive insulin up, you drive cancer growth. The eighth is to avoid alcohol. Really, there's no reason to drink alcohol for health at all. And alcohol doesn't just cause cancer to your liver or your GI tract, it increases your breast cancer rate. Also, after meals, please exercise. That improves your insulin sensitivity, your immune function, your blood flow, your lymph flow. It gives your muscles a massage, right? It helps you reduce inflammation. You don't have to do anything special, just walk. It's better than sitting all day long, right? Because when you increase your movement, you stop putting that tourniquet on your butt, and your body and your immune system really depends upon circulation to clear and to be able to fight cancer. Now, the last thing, the 10th item, is that please go seek help when you have unexplained weight loss, blood in your stool, you find a new lump anywhere, you have bleeding in areas that you're not supposed to bleed, or you have trouble swallowing, persistent cough, you feel bloating, you see a kind of weird growth on your skin, you're anemic or tired. There's so many symptoms that's abnormal that only you know about. Even if your screening is normal, seek a second or third opinion for professionals. We don't want to wait until you're absolutely at the point of no return, right? And that's why a lot of these lists are things that we can do every day to reduce our risk of cancer. But I know I went over all of these things quite quickly. And if you want to learn more in detail, let's say about mushrooms, watch the next video.